Hello, welcome to It's Your Case with Vet CT. I'm Copper Aiken-Palmer. I'm a specialist with the American College of Zoological Medicine. I'm going to be talking to you today about rabbits with nasolacrimal disease. Let's get into it. So what happens when a rabbit comes in with a runny eye? Usually they're going to have matted fur. This picture here is not the best quality, but you can really see that this has probably been going on for a little bit. So the fur is matted down. There's some crustiness to the discharge around the eye. They don't have conjunctivitis. There's not necessarily reddening of the conjunctiva, but they just have loss of fur in this area too. And usually that's because of nasolacrimal disease, either narrowing or complete obstruction of that duct. So dacryocystitis is a technical term of inflammation of the nasolacrimal duct or the tear duct. And that's because of this narrowing or obstruction that the tears cannot actually make it from the eye down to the nose. The presentation is that it can occur really with any age and any breed, but we do know that the Netherland dwarf breeds are prone to blockage. I've got this QR code. It's a really nice paper by Florin et al. And talking about the clinical presentation as well as the outcome of nasolacrimal disease in rabbits. So if you have further interest, be sure to scan that and take a look at that paper. I do want to mention, like this rabbit here, he has quite a bit of nasal discharge, and that nasal discharge is pretty thick. So that discharge alone could actually cause obstruction of the nasolacrimal duct, preventing the tears from coming out and causing the matting and all of the tear staining around the eye. So we're going to get into the anatomy, and before you complain too much, the anatomy is really here to help you know what the at-risk spots are so that you know where to look for underlying disease. So the etiology of nasolacrimal narrowing or obstruction is usually dental disease. So about 50% of the time it's malocclusion of the cheek teeth or the incisors. So if you look at the green in the top, you can see by the eye there's two lacrimal sacs, and those should be draining down towards the nose, allowing the tears to come out the nose. As they drain, there's a bend kind of right out from those sacs, and that is actually near the reserve crowns of the cheek teeth or the premolar molars. Now, this bend alone puts that spot at risk for narrowing, and because there's a bend there, the narrowing can actually become worsened if there's elongation of the reserve crown. So basically the root of those cheek teeth are impinging either directly on the nasolacrimal duct, or they're causing swelling of the soft tissue area around the nasolacrimal duct, causing compression of that duct. So it can become occluded or narrowed because of malocclusion of those cheek teeth. As you come down the duct, it's a nice straightaway, and so it's rare to see any sort of occlusion in the straightaway. But as it hits the next bend near the reserve crown of the incisor, that's the other at-risk spot. So that spot right there is a bend, so already at risk, but then it's near that root of the incisor. And the root of the incisor could become elongated if there's malocclusion. So if the teeth are not wearing appropriately, the rabbit's not chewing on that high silica hay, that grass hay, then they can't have malocclusion because they're growing more than they should. And if the teeth that you can see above the gum line are not able to grow, then they start growing more below the gum line, and that's when they start occluding this nasolacrimal duct. So if the problem is not there, then it's actually further down. So there's two more bends that the nasolacrimal duct takes before it actually exits out the nose. There's a lot of soft tissue there, and that's another high-risk spot. So if it's not the teeth, then it's probably just idiopathic. So 30% of the underlying cause of nasolacrimal disease can never be detailed. But if it's not the teeth and it's not just idiopathic, then it's going to be ocular or respiratory. And the reason it's respiratory is because if there's rhinitis or sinusitis, it can cause a narrowing or occlusion down by these next two bends here. And that can cause a backup so that the tears can't flow out, and then you see a perfora out through the eye. True ocular disease can also cause it because of the inflammation occluding the nasolacrimal puncta up at the medial canthus. So those are all of the at-risk spot. Again, here's a nice QR code. This is for the paper that this image is in, and so if you want to go back and reference this image later, it's got a lot of nice description of sort of why nasolacrimal disease happens in rabbits. So I like to start by ruling out the least likely diseases, the ones that are easy to rule out. So I start by my exam by looking for respiratory disease in these rabbits. So as I look at the face of the rabbit, I'm looking at the eye, I see the aperfera, and then I look at the nose. If I see a nose that's nice and clean, like this picture imaged here, no discharge, no wetness around the nose, then my next thing is to wonder, is this rabbit actually grooming off any sort of discharge? So I look at the front feet. I'm looking for crusting or any sort of discharge on the front feet. And sometimes you'll see a rabbit that has respiratory disease, but there's no evidence of discharge from the nose, but you'll actually see it on the front feet. So because there's such fastidious groomers, that's a place to look and something that we don't necessarily think about for other species. Obviously, you're going to auscultate, listening for increased respiratory sounds there for the lower respiratory tract or the upper respiratory tract. If that's all clear, then I move on to looking at the eyes. So during the ocular exam, I start with the fluorescein stain. So I just go ahead and drop the fluorescein stain into both eyes because you need to look to make sure that there's no corneal corneal abrasion. If there's a corneal abrasion, that can cause increased aperfera, so you might see increased tearing from the eye. So after I drop in the fluorescein stain, it should be coming out the nose almost immediately. So you can see in the picture here, I know it's a dog, it's not a rabbit. Couldn't quite get an image of a rabbit, but you want to see the bright fluorescein stain come out of the nose almost immediately after you put it in the eye. And if you do see that, then you know that the nasolacrimal duct is actually patent. If you don't see that, then you know it's either narrowed or completely occluded. And this is the best diagnostic for knowing if you have true nasolacrimal duct issue or if maybe you have a primary ocular issue and there's tearing because of disease in the eye or if because the tears cannot flow out to the nose. So after I pop in the fluorescein stain, then I put a little slight pressure on the puncta, so near the medial canthus, to see if there's any sort of discharge that's going to come out of there. So any fluid or anything that comes out of that area. I go ahead and take a sample for cytology. So I go ahead and take a sample and put it on a slide. And I take another sample for aerobic culture and sensitivity. Now, I don't necessarily know that the owners are going to let me run the culture and sensitivity at this point, but I just go ahead and take the sample so that I know that I have it before I do the rest of the exam. And that way, too, I know that I have it and that I can go ahead and run it and don't have to bother the rabbit again with taking samples after I've completed the complete physical exam. So the other thing you want to do is just finish your eye exam. So doing intraocular pressure, looking for glaucoma. We certainly see a fair amount of glaucoma in rabbits that can cause changes to the surrounding tissues and occlusion of the puncta and inability for the tears to come out through the nose. So after that, the next thing you're going to move on to, if you don't see any cause of ocular disease or respiratory disease, the next thing you want to do is look at the teeth. In order to look at the teeth properly in rabbits, you certainly can do the exam with them awake, but we know that we miss about half of the dental disease by just doing an awake exam. So unfortunately, to do a complete dental exam, we have to sedate those rabbits or anesthetize them so we can see all the way back in the back of the mouth and do imaging. Ideally, the imaging is CT, but of course you can always do radiographs to look for dental disease in these rabbits. And it's really the strength of the oral exam as well as imaging to diagnose any sort of abnormality. And really remember, you're actually looking for changes in the reserve crowns. So you may not actually be able to see any changes inside the oral cavity if you're looking for changes to the reserve crowns that could be impinging on the nasolacrimal duct. So imaging is going to be the real strength here for suspected nasolacrimal disease. The other thing is it's really nice if you can do a CT with contrast. So that is putting contrast into the nasolacrimal duct. So the picture here on the right, you can actually see that we're putting using a small cannula. So this is actually a IV catheter with the needle removed. So it's just the soft portion of the IV catheter going into that single puncta. And you want to apply a little bit of pressure near the medial canthus as you put this in, and then just a small amount of pressure to put the contrast in. You can actually overextend the nasolacrimal duct and potentially cause trauma to the nasolacrimal duct if you apply too much pressure on the syringe when you're putting in the contrast. So ideally, the contrast is really going to light up the areas along the nasolacrimal duct that may be a problem. So these images down here from Vet CT are really nice in that you can see where the issues are. So there are clear dental disease and the one in the middle, and that's highlighted by the purple area arrows, and so they have elongated reserve crowns. So those cheek teeth have too much root to them, basically, and that's impinging on the nasolacrimal duct. You can see that there's some narrowing there. And then in the other image, you can actually see complete obstruction in a couple of areas, again, at the bend. So the bends are the problem. There are problems at the bend near the cheek teeth as well as the incisor, and then again, coming out through the nose in these images here. So treatment and prognosis, what are we going to do? Early intervention and treatment is really key. So the minute the owner is seeing a perfora, hopefully they're giving you a call so you can go ahead and start some diagnostics. And I say early because if these cases go on for 3 months or more, we know that the nasolacrimal duct is becoming scarred and that the prognosis for return to complete normal is low. So early intervention is really important. And then treatment, if you can start by removing the underlying cause, is really going to result in a better long-term prognosis. And treatment is again, improving the malocclusion if it's present, improving the underlying ocular disease or respiratory disease, and if it's idiopathic, then just treating the nasolacrimal duct in itself. Often they benefit from sampling for aerobic culture plus a saline flush, and doing that saline flush with a 23 gauge catheter into the duct is going to help remove a lot of that debris. So sometimes you can remove the underlying disease, so improve the malocclusion, but they're still having a perfora, and that's because there's some of that mucus or discharge is kind of built up in the nasolacrimal duct. So if you can flush it, then that often will help kind of get them jump started towards improvement. I tend to use systemic antibiotics instead of topicals, but certainly topicals are a good option to use in the eye. But I find that rabbits get irritated by ocular medication, so I just go ahead and do systemic antibiotics as well as anti-inflammatories. Now, ideally, you've been able to perform a culture and sensitivity, but if that wasn't possible, my first choice is azithromycin, and that's because it has great penetration to the eyes, it has good penetration to the soft tissues throughout the head of the rabbit, and it also has a little bit of anti-inflammatory effect as well as good spectrum for the microbes that are usually causing the problems. I also tend to see really rapid improvement with azithromycin. So if you're not seeing improvement after the first dose, then maybe the azithromycin was not the best choice, in which case enrofloxacin is kind of my second choice. A lot of people start with enrofloxacin. That is certainly fine. I just don't think it has the same tissue penetration as what I see with azithromycin. I do want to make sure that you know that only about 50% of these cases are going to be resolved to the owner's level of satisfaction. It can often take a long time, so it's reasonable to, from the start, let the owner know it's going to take 2 months of treatment to get this under control, if possible at all. Recurrence is very common, and if it's been a chronic condition, chronic being going on for more than 3 months, it's probably never going to have normal tear drainage to those nasolacrimal ducts, and so it's possible it will always have some level of tear staining. So managing the owner's expectations are important because these are frustrating cases and many of them never resolve completely. So in summary, the diagnosis is with fluorescein stain. So doing the fluorescein stain to make sure that it penetrates from the eye down through the nose to make sure it's draining properly. If not, you have a clear diagnosis of nasolacrimal disease, either obstruction or narrowing. And then you want to move on to CT. And you may want to actually do a serial CT. So taking the first CT, find out what the underlying disease is, assuming it's malocclusion, you work on those teeth. Then you want to follow up with another CT down the road and see if the dental disease is improved. Has it completely resolved? Are the nasolacrimal ducts now open? So instead of thinking of it as one CT, then you're probably actually going to need to do more than one so that you can monitor response to therapy, especially in those cases that may not be improving as quickly as the owners wanted. Can you do radiographs? Of course, radiographs are a very reasonable option to diagnose dental disease in rabbits. If you can't do CT, radiographs are a reasonable option instead. Etiology, 70% of the disease, the underlying disease of nasolacrimal obstruction or narrowing in rabbits are because of disease in the head. So as you do the exam for these cases, know that you basically don't have to look below the neck. The disease is in the head. And if not, then it's just idiopathic and there's really nothing that you can do to remove the underlying cause. Successful therapy, hopefully that is possible, and it's definitely worth the money to go ahead and conduct the aerobic culture and sensitivity in the beginning before you've started any antibiotics. And I say it's worth the money because these cases can be frustrating, they can be recurrent, and they can go on for quite some time. So it's actually going to be a decent financial burden on the owners to treat these cases. So if you can do that aerobic culture and sensitivity early, that's going to put you on a good road for choosing the correct antibiotic and a better potential for resolution in these cases. Topical ophthalmic antibiotics or anti-inflammatories are very reasonable. If the rabbit acts irritated by them, then just move to systemics. Often I'll actually start with systemic antibiotics and anti-inflammatories, and if I'm not seeing the resolution that I want, go ahead and start topical at that point. Some rabbits are pretty painful, and they actually need more than just an anti-inflammatory, so they need analgesics, and my go-to is actually buprenorphine. Prognosis, this is a tough one. Prognosis is guarded in any of these cases, and that's because so many are idiopathic and we can't actually correct the underlying cause. Only 50% have any clear resolution to the owner's liking. So often the owner is the one that's not satisfied. You might be happy because it's improving, but the owners may not. So it's a good idea to ask the owner what their goal might be and prepare them that could be recurrent and it could be chronic, especially if this has been one that's been going on for 3 months before it gets to you, because we know that those nasolacrimal ducts have scarring and they're probably never going to return to normal. I want to point out two of my favorite resources here. So we've got Rabbit Medicine by Anna Meredith and Bridget Lord. I think there's a newer edition out, but they have different authors, and this one is truly my favorite. They do a great job of going through rabbit medicine. So if you do see rabbits, please get this book. It's a great reference. And then my other favorite is the brand new Exotics Formulary by Carpenter. This book is actually double the size of the previous edition, so it's well worth it. The price points really come down on this book too. So it's got all the medications in there that you want to use, so be sure to get that book. And I appreciate your time today for talking about nasolacrimal disease in rabbits. Have a good day.